Welcome to Surgical Insights with Dr.Deepz YouTube channel. Today I would be presenting about calcium hemostasis, otherwise calcium homeostasis it may be pronounced, and normal reference range is 2.1 to 2.6 millimoles, and then 8.5 to 10.5 mgdl, that is milligram per deciliter. This is the normal range of calcium, and calcium is one of the important minerals among our body, and we have to know one thing, that it is, if it falls very low, then it may result into tetany, which is muscular spasm as a result of hypocalcemia. Okay. And next thing we have to know about arrhythmia. Irregularities can be seen, irregular heartbeats can be seen while dropping off hypocalcemia. Other than that, it is more essential for cardiac function and muscular contraction, then nerve conduction, and blood coagulation, and finally it is more important for bone mineralization. These are the important facts of calcium. Okay, now coming to calcium homeostasis, I can split into three category of calcium homeostasis. One is if a calcium falls, and second is if a calcium is normal, and third is if a calcium rises. In first criteria, when a low calcium occurs, when a low calcium or calcium falls, then parathyroid gland releases parathyroid hormone that triggers calcium to increase in blood. Okay, so we are going to learn how it increases. So here I have made it very simple using Dhoom 2 characters. So parathyroid hormone is actually Hrithik Roshan in Dhoom, who plays as a Aryan chief. He is actually a great thief in stealing the gold. In contrast, parathyroid hormone is also a thief that steals calcium from the bone. Okay, so hope you understand. So we are going to discuss how it steals the calcium from the bone. So parathyroid hormone actually activate osteoclast through osteoblast. Okay, parathyroid gland activates osteoclast via osteoblast. Okay, now I would like to differentiate between the osteoclast and osteoblast. In osteoblast, something B is seen here. It builds new bone. It builds new bone. Whereas osteoclast, okay, breaking of bone, clustering of bone. Okay, it's a breaking of bone, clustering of bone. Okay, and next thing is using protein signaling, it breaks the bone, and from bone the calcium releases, and eventually blood calcium rises here, and phosphate is decrease, blood phosphate is decrease here. So now I'm going to give you a small story scenario of PTH, that Hrithik Roshan steals a sword in a fort in this Dhoom 2 movie, and he steals golden sword, and in contrast, parathyroid hormone steals calcium using osteoclastic activity. Okay, osteoclastic activity, this is the thing. And Hrithik Roshan activates Suneri. Okay, Suneri, who's a vitamin D. Okay, from inactive Suneri to active Suneri. Okay, further would like to say Hrithik Roshan travels to kidney. Hrithik Roshan travels to kidney and activates Suneri, from inactive to active form of Suneri. Okay, now here he uses hydroxylase. He uses 1 alpha hydroxylase to activate and Suneri, and inactive vitamin D is also known as 25 dihydroxycholecalciferol. 25 dihydroxycholecalciferol. To active form of vitamin D is 125 dihydroxycholecalciferol. 125 dihydroxycholecalciferol. Now, what are the functions of active form of vitamin D. So active form of vitamin D comes under normal. No, normal. Okay. When the calcium level is normal, this is the second phase. Okay, it comes under the normal. So here we are going to talk about the important task of normal calcium, that is active form of vitamin D, second phase, and it actually takes gold and rock. Okay, gold is calcium and rock is PO4, phosphate, from the food in intestine. Okay, from the food in intestine. Actually, Hrithik Roshan activates Suneri in kidney, and eventually through intestinal absorption, Suneri travels from kidney to intestine. Okay, so thus she receives calcium and phosphate in intestine, calcium and phosphate in intestine, okay, through food. Okay, through food. And eventually you can see increase in plasma calcium, increase in plasma calcium, and increase in plasma phosphate, increase in plasma phosphate by increase in renal tubular reabsorption of phosphate. Okay, and this also supports increase in osteoclasts. Okay, this also supports increase in osteoclast. Okay, so this is what you have to remember. The main difference between parathyroid hormone and vitamin D, active form of vitamin D, is one difference, which is decrease phosphate in blood. Okay, decrease phosphate in blood, and here increase phosphate in blood. That's all the differences, and both of them uses osteoclastic activity. Okay, and there is a word in sentence in Doom 2, कल हीरा भी गिरा सकता है और चीरा भी गिरा सकता है. So it is calcium. Okay, calcium and phosphate. Hera is calcium and phosphate is Hera. Okay, so hopefully this is easy. Next comes calcitonin. In calcitonin, please wait. Let me. Okay, calcitonin is very simple compared to parathyroid. Okay, hopefully it is visible. Okay, calcitonin actually, here Abhishek Bachchan comes to the picture here. Abhishek Bachchan as Jai comes to the picture here. So calcium is actually high. Calcium, I can say gold is actually high. So he wants to lock and preserve the gold. So what he does is, here the calcitonin comes and closes the osteoclastic activity. Okay, osteoclastic activity closes and increase in osteoblast activity in order to close the calcium and restore within the bone. Okay, and phosphate also, here the thing is, calcium is decreased in blood, phosphate is also decreased in blood using osteoblastic activity. Okay, that's all for your this thing. Hopefully you understood this well, and thanks a lot. Okay, and kindly subscribe, and those who have doubts can directly put into comment and ask the question, and finally like it and share to your friends. Okay, in order to make a growing and loving audience. Okay, thanks, bye.